and welcome to another episode of Health Options, the program that not only tracks government policies on health, but provides you with the information you need to make informed choices about your health. Many thanks for joining us on the program. I am Rabi Abdullah. As the length of life, number and proportion of older persons increase in most industrialized and many developing nations, a central question is whether this population aging is accompanied by sustained or improved health, quality of life, and sufficient social and economic resources. The answer to this question lies partly in the ability of families and communities, as well as modern social, political, economic, and health service delivery systems to provide optimal support to older persons. However, while all modern societies are committed to providing health and social services to their citizens, these systems are always guided by diverse and evolving national and regional policy formulations. Health, social, and economic policies for older persons vary substantially among nations. On this episode of Health Options, we shall beam our searchlight on how Nigeria is faring in this regard as we examine older persons' access to health care. You'll get to meet my guest shortly. This is Health Options, and we're taking a look at how the country is enhancing the health status of older persons, also known as senior citizens. But before we get down to the discussion, let's hear what this strong advocate of better deal for older persons in the country has to tell us about their health and social needs.
Many factors, many things are detrimental to the well-being of older persons. The one I want to touch on is ageism. The very negative social construct about old age, the stereotypes and the prejudices that we carry that now cause us to act in a very discriminatory way against older persons. And so you see, when people get old, even the image of aging, nobody wants to be old. At that level, you look at yourself in the mirror, you don't want to get old. And then when it comes to where older persons are really sick, I talked about dementia. And then you have that cultural orientation that they are witches and they are wizards. Dementia is not only a biomedical factor. Dementia is a social factor, social cultural. So, some strong sensitization, advocacy, to change the mindset of people, because they are discriminated against, they are stigmatized, because they become incoherent and they become forgetful and say, oh yes, they are confessing their sins. They had killed somebody, they had murdered, And then most of them are thrown out, not to talk about the neglect. So that is one aspect. And the other aspect is now the burden of care on the part of the family carers, especially those ones who really don't have the financial wherewithal, and those ones who can't pay a nurse to, because it's 24/7 care. Because they really are forgetful. They can wander away and get lost. And when they are caught outside, they are lost. They cannot remember where they are coming from. And that becomes another case. Most older persons who suffer from, this cognitive impairment are lost on the streets. So that is one section. The ageism and the worst part of it is systemic ageism. Not just the individual casual, negative attitude about older persons. Is when the system, I talk about institution, policies and all, budgets, discriminates against older persons, does not include older persons. Think that older persons, because they are old, they are spent, forgetting that they are bona fide citizens of the country, covered by the Constitution, and they are contributing and yet still contributing as fathers and mothers. They are contributing as farmers, as artisans. They are contributing as retired professionals. They are contributing, as, mentors. They have that link for the next generation, that intergenerational life link. So we are losing a lot, the value, the contribution, and we should be celebrating their resilience. I want to say that older persons, like every other age category, are entitled to their human rights. They are entitled to what the Constitution provides, which it says is the duty of the states to secure maximum welfare, freedom and happiness to all its citizens on the basis of social justice, on the basis of equality of status, and also on the basis of opportunity. So yes, older persons are entitled to health, to good environment, to income security, to social protection. Most of our older persons who are vulnerable today are those ones who grew along the life course poor, and because of inequality, because of ageism, because of discrimination, there was no intervention. But it's very easy sometimes to say, okay, it was out of laziness. Some people say it was out of laziness, but most of the times you find out that it was the lacking of opportunities, the lack in opportunities. So that is why social protection is very important, because social protection is what lifts people out of poverty and what guarantees people, to face some very, difficult events in life. So social protection is very important. When we talk about accessibility to healthcare, as also we talk about income security, social protection, we cannot talk about availability of those things or in a sustainable way if we do not look at institutions, government institutions, we do not look at policy, that are policy responses, if we do not look at research and data and disaggregated data, and we do not look at human resource provisions. So when we look at the needs of older persons, we start with the institutions. Who are those? Which institutions are responsible? And how responsive are they to these gaps that we have talked about? Healthcare, social protection, social connections, interactions, recreation that is needed, a supportive environment. So which are those institutions when we look at Nigeria? And so we can identify some institutions, the Federal Ministry of Health, the state ministries of health. We can identify now, we used to have women affairs and social development. Now we have Federal Ministry of Humanitarian Affairs and disaster management and social development. So yes, we can say we have these institutions, oversight institutions. And now we look at the policies. Do we have policies? Right now, as I tell you, we have, I must say now that this government really has been responsive, and more discussions have been had concerning aging under this government. However, it has been so delayed, the national policy on aging. And until we have a national policy on aging, which yes, we have finished the crafting of the policy, the stakeholders came together, it was supervised under the then Minister of Women Affairs, but there is a delay. And we finished this last year in October, and we are still awaiting the consent of the Federal Executive Council. Until you have an overarching policy, a policy that connects, because issues of aging are multi-sectoral, intersectoral. We just talked about health, we talked about social security, that is in Federal Ministry of Labor and Employment. And then you talk about agriculture, because 60% of older persons are engaged in farming. So when you look at all these issues, you see that it's multi-sectoral, and so it needs a comprehensive policy, it needs a coordination, it needs a national technical working group on aging, because no one ministry can handle aging. So when you don't have a policy, it means that you don't have a strategic implementation plan. Whereas the Ministry of Health will come out with a framework on geriatric care. That framework has to be fitted with other sectoral, for instance, the primary healthcare center has to be there. Community care has to be there. Family has to be there. It's also interrelated, that not one ministry can run along and leave others. The case of COVID-19 showed us that when you're looking at health, before you know, it becomes a social, economic, and psychosocial issue. So all the stakeholders must come at once.
Joining me now in the studio for more insights into the issue is Dr. Said Ahmed Dumbulwa. He is the National Coordinator, Healthcare for Older Persons at the Federal Ministry of Health. Welcome to Health Options, Dr. Said.
Thank you very much, Ravi, for the invitation.
Okay, before we get down to the discussion proper, I think it will be nice if you situate who exactly, the older persons are.
Okay.
What category of age group are referred to as older persons or older citizens?
Yeah.
What age?
Yeah, it's all right.
Yeah, what age?
Yeah. Actually, the definition of how to make people understand what all the persons they are is that according to the United Nations and the WHO definitions, that anybody who's over 60 years of age is defined, actually classified to be an older persons. And today we have almost about 15 million Nigerians who are over 60 years of age, and the Nigerian government is actually committed to improving the quality of care of this vulnerable population.
Okay, before we get down to what the government is doing or how committed the government is, towards the enhancement of their health status, I know that, like I highlighted in my intro, nations take charge of these things, but, strategies vary, right?
Yeah.
From, when it comes to industrialized and developing nations such as ours, talking about Nigeria now. How has it been? Because would you say that...
In the African continent, we have what is called a strategic, the global strategy of action on health and aging that was actually launched in 2016. By the WHO, regional WHO area, where all the member states country in Africa endorsed to it. And among it, they're actually trying to address the following thematic areas. One, the clinical care, the training of the healthcare workforce, the research, and the health social support. So this is basically the commitment of the African region, in the bid to actually address the healthcare workforce, the clinical care, the research, and the health socials. Now, taking for instance about the issue of the clinical care. Immediately after the 2016 declaration, the Nigerian government felt that it's important to actually follow up within some of its own commitment. So we came to actually conduct a kind of assessment. After conducting assessment, then we realized the result came out that Nigeria is grossly inadequate in terms of the healthcare workforce we have. So now we know that...
Is it about the human resource for health in general, or those ones attending to the health needs of other persons?
No, those actually attending to the health needs of the older persons.
Is it like the geriatrics?
Geriatrics, that's it. The healthcare for the healthcare workforce or the healthy aging that we are referring to the geriatricians, the geriatrics. Yeah. So actually we are able to conduct that need assessment, and sequel to that we came up with a result showing that Nigeria is grossly inadequate in terms of these specialists, that the geriatricians in Nigeria. So that actually make us to see how do we come with this approach. How do we address this issue? We must be part of this scaffolding of the health system of the elderly. We must align with the global trend whereby the health system actually looks not only treating people, treating people who are different. Even though we know elderly people are not all homogeneous. You understand? You may see somebody who is 70 or 80 years and still looking like 40 years old. They are naturally not homogeneous. Then, sequel to that, then we came up with a national policy framework. The president actually launched a policy framework, national policy on healthy aging, which actually the one that troubleshoot the development of the regional ECOWAS strategic development plan on healthy aging for 2020 to 2024. This actually gives us a bearing on where to go. You understand?
Yeah, but we know that prior to 2018, before the clarion call by 2016, sorry, before the clarion call by the WHO, it was just at a low end.
Yeah, certainly.
Okay.
Yeah, certainly. It was actually, there was not much, we are doing to actually, to say that we are actually going, despite the fact the population aging is ever increasing in the country, but yet there was not much to say that we have on ground. But until after the 2016, the declaration and the commitment of the government in 2016, then that one actually we started. And we've been very proactive and very progressive in that.
Okay. How exactly have you been? Because how has the fortune of this category of, segments of a segment of the population, faring right now?
Yeah.
Because it's more or less 3-4 years down the lane now.
Yeah, 4, yeah.
Has their lot improved in any way?
Yeah, certainly, whenever you are trying to actually change a system, you must stand from the very beginning. You understand? You have to put the fundamental pillars to see that, okay, now you've conducted an assessment, you don't have this kind of geriatricians, so what are you supposed to do? The government actually made a commitment of establishing regional geriatric centers in the 6 geopolitical zones with the aim of training the healthcare workforce so that we have more geriatricians, more care carers that will look after the health of these older persons in the country. And today we have actually almost completed a need assessment in some of these teaching hospitals that are supposed to be kind of a stand-alone, but in the teaching hospital, because geriatrician, the geriatric care is more multidisciplinary kind of approach to it. So you need to actually, it needs to be situated in the teaching hospital where you can actually tap the expertise of, different speciality to be able to actually come together and look after the care of the older persons.
Okay, we know that immunity tend to decline as people age. And once one gets to this age group of older persons, older citizens, that's 60 and above. All sorts of underlying
comorbidities. Yes, it's very interesting to note that the research that have shown that people who, we know that the immunity actually tends to decline as you grow older, you understand. But one very interesting article and research that actually we discovered that people, as you actually cross over to 70 years of age, then it turns out that there is tendency for you to live longer, you understand. So it's more critical for you to live from 60 years to 70 years. But once you pass 70 years, it's more likely that you may live longer, you understand.
Wow, so that's good news. So for those who has the grace of crossing
70 years. Most likely we realize that the critical, you see, if you look at the data, is that people usually, especially in developing world, you understand, you see the mortality rate is usually from 60 to 70 years, you understand. The few that actually cross over to 70, we realize they are there and they are living and they are happy. As I told you earlier, that the health of the older persons is not homogeneous. You understand? So because of this issue of difference, variability in terms of their health well-being, so some of these people are actually who are not frail, you understand?
Yeah, and I think it boils down to lifestyle.
Yeah,
previous lifestyle lived when one was still able and kicking. So can you just touch on that? The need to live a healthy lifestyle, before you even get to that age group of older persons.
Yeah, you see, one thing that is very important for you, you cannot actually get a dividend without an investment. You understand? Look at it from this perspective. That means if you want to live longer and healthy, you understand, to be non-frail, you understand, then that means you have to start investing. Investing in what sense? By actually changing your lifestyle, you understand, in terms of dietary, in terms of doing a physical activity and actually doing a kind of regular checks, to know your situation, what you are, you understand, as a whole. Is there any problem? Is there any pathology? And if there is, actually, then you consult the relevant doctor for you to address the issue.
So that's where regular checkup comes in now. And I'm sure, unfortunately, the culture is not what it should be in this part of the world. I don't know if you agree with me. Well, people rarely go for medical checkups except something sets in.
Yeah, you see, that is part of the component of what we are doing in the ministry, trying to create awareness, to tell you that it's not, you don't need to wait until complications sets in as an older person before you actually start knowing what the status you are, you understand? So the issue also, let me take you back, the issue of investment, you have to invest. That medical checks, so is part of the investment, you understand, for your own well-being. You have to invest. You have to actually do that regular checks. Don't wait until you're actually down or you're actually down with complications before, a doctor cannot do magic, cannot reverse what has actually been damaged, you understand?
Okay, that's where support comes from. Families, communities, government. On the part of government, policy formulation and all of that. And that's taking me to the crux of our discussion now, accessibility to health for people within that age group. What is in the pipeline, or is something being done now? For instance, like health insurance and what have you. What do we have on the ground?
Actually, it's a very good, we have a very good development, so to say, because after the presidential statement of the president on how to improve the quality of care, and we realize that one of the pillars, the thematic pillars of the global strategy of action is that to see how we achieve the kind of universal health coverage, you understand, of the older persons, you understand, is very important, and it must be actually go streamlined with the provision of the healthcare for all people, not only older persons. So health insurance in Nigeria now, we're actually focusing to see all civil servants actually get health insurance, you understand? That means people who are over 60 years, when they retire, they actually go on with their own health insurance until when they are 70 years old. And when they are 70 years, they move to non-contributory health insurance.
Is that what exists at the moment?
No, it's not.
Okay, it's what you're working towards.
What we're working actually on it. See how people, when you retire from the government as a civil servant, you continue with your health insurance until when you are 70 years of age. From there, you move to non-contributory health insurance. You understand? And also, the elderly people who have never worked in the government, you understand, have never invested or actually contributed in the contributory scheme
That's
from
the
the 60
informal sector.
informal sector. For the informal sector, actually, what we're proposing, actual plan is that anybody who is over 70 years of age, you understand, should benefit from this non-contributory health insurance scheme. And soon the Honourable Minister actually is working so hard on it to see how in collaboration with the PITA, PENCON and so forth, some relevant stakeholders that actually come and brainstorm to see how it's going to be actualized. For instance now, permanent secretaries actually they retire with their salaries, you understand?
Yes.
So don't you think it's very easy for them to just continue? Yes, sir. So these are some of the things we're actually working on, you understand? And now at the moment already the police have started. The police have started enrolling people who have retired from service, you understand? So all this one is also part of the fight against anti-corruption, you understand? If you look at it from that perspective, you understand? Because some of the fear that people think that when I retire, I don't have any insurance, you understand? That fear of the unknown, what is going to happen, you understand? It causes a lot of problems.
Well, I'm interested in knowing, because we'll all get to that age group someday, sooner or later. I'm interested in knowing how soon that can be, fast-tracked.
Yeah.
How soon can that be made to cascade so that, within the shortest period, people within that age group, whether for retirees or those ones that are in the formal sector and the non-informal sector beneficiaries, can actually be given that sense of belonging to enable them really live a happier life.
Actually, in the spirit of inclusiveness, to ensure everybody actually is taken on board, you understand, I think in the next couple of weeks, you understand, the committee will be inaugurated by the Honourable Minister, you understand, and it is going to take like a couple of 2-3 weeks to conclude its all report, and thereafter actually the government will take a decision, you understand, when exactly is it going to be end of this year or early next year, you understand, it's going to be in phases. One, the civil servant, then thereafter the non-contributory health insurance.
How far are we from getting a policy on?
Well, the policy, you see, as I told you earlier, we have one policy that was launched, a policy framework that was launched by the Mr. President in 2018 December on healthy aging. Yes. And that's one is the one that lead to the development of the regional, the ECOWAS one. Then we have a kind of a comprehensive policy that is encompassing, multi-sectoral, you understand, and it involves a lot of ministries. There's a policy on aging. We're actually about to actually launch it also. We are working closely with the Ministry of Humanitarian and Social Development and Federal Ministry of Health and other relevant stakeholders to ensure that we actually launch the document. And soon also, the document may likely be launched maybe toward the end of this year. Okay,
I don't know. Is there a sort of special package for, these older citizens, especially now that we're in a pandemic?
Yeah.
And we know they are worse hit. Anyway.
Yeah, I agree with you. You see, if you look at the data from the NCDs, you realize the people who are most hit they're the people who are over 60 years of age, the mortality, because of it's not surprising because of the comorbidities associated with it. But it's so interesting that the PTF also, if you look at the COVID budget, you understand, you look at it, that the PTF considered the importance of that, because this segment, this proportion, these people who are actually over 60 years, the mortality rate among them is more, you understand, is higher, you understand. So they actually identify the need to actually look into them. They have captured something for activity, for doing some programs to improve their well-being also.
Okay, thank you so much,
Dr.
Saidu Ahmed, for joining us on Health
Thank you very much, Rabi.
It is in your best interest to keep observing the safety protocols of COVID-19. Protect yourself and the people around you. A quick reminder also that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.